Travellers to the US from areas affected by the Ebola outbreak will be subject to enhanced screening and monitoring measures as the country's Centre for Disease Control attempts to reduce the risk of the virus crossing its borders. As the disease continues to spread, a report has been published by the Global Preparedness Monitoring Board, set up in the aftermath of the 2018 Ebola pandemic. Tasked with assessing how prepared the world is for future pandemics, it paints a grim picture. Despite lessons supposedly learned from the devastating impact of COVID-19, the risk factors are increasing, a situation made worse by climate change and geopolitical instability. According to the report, the world is not substantially safer from public health emergencies than it was 10 years ago. Trust in government to tackle crises has been eroded, and equal access to vaccines has not improved. A number of goals were highlighted: better risk monitoring through the World Health Assembly, along with equal access to vaccines and funding, and stronger global cooperation in the health security sector. Now, the current outbreak of Ebola has left at least 80 dead in the DRC, with the Congo's neighbours tightening border controls. Our correspondent Chris Ocamringa is in Kinshasa.
The Democratic Republic of Congo has activated what they call emergency response operations. They have sent medical teams to all the border points of the DRC. The DRC shares borders with 9 countries, and the World Health Organization said that these neighboring countries are at high risk of getting the disease after 2 cases were reported in neighboring Uganda. So these countries have really stepped up measures to stop this disease from affecting more people. We know that countries like Burundi, Tanzania, Uganda, and even Rwanda have already sent teams carrying out surveillance, testing people who have symptoms of Ebola, and they have really strengthened the areas where they share borders with the DRC to ensure that people from here do not go and infect people in their country. Rwanda has actually closed one of its borders in the east of the DRC with the DRC because they are fearing that it might create a problem in their country. The World Health Organization has advised countries to avoid closing borders or issuing travel restrictions, but Rwanda has not heeded that because they feel they have the sovereign right to decide how to manage this outbreak.